Okay, today I'll be talking about the heart. The heart is made out of a cardiac muscle, and it is a muscle pump that will be pumping the blood um, through the pulmonary circulation. That's where the oxygenation will take place through both lungs. Then it will take this oxygenated blood into the systemic circulation. Now, first of all, let's take a look at the structure of the heart. This is called the apex. So the apex of the heart is being formed by the left ventricle, while the base is right there, superior. That's where the blood vessels will be located. Now, first let's start off with the superior vena cava that will be draining the venous blood that's coming off the head and neck, the upper limbs, and the thoracic region. That's anything above the diaphragm muscle, and at the bottom, number 4 right there, that's where the inferior vena cava will be draining or collecting blood from the lower limb, the pelvis, and the abdominal region. Now let's go ahead kind of dissecting through here. So this is the right auricle. This is the left auricle. This is the conus arteriosus. And this is the right ventricle. Let me go ahead and further dissect or kind of open this up. So here, again, we have the superior vena cava. This is the right atrium. This is the right ventricle. This is the left atrium, and this is the left ventricle. Now, if you look over here, we have 4 different chambers, and they're being subdivided by a septum. So this is called the interatrial septum because it's present between the both atrii. Interatrial septum. Now, the septum that's present between both ventricles is called the interventricular septum. And again, we would have a small septum right here, just next to the valve itself, and it's called the atrioventricular septum. And again, this will separate between the both atrii and the ventricles. Now, this is a valve. So first of all, we have 4 different chambers, and we have 4 different valves. So the first 2 valves I'm going to be talking about are the tricuspid valve that will separate between the right atrium and the right ventricle, and the bicuspid or the mitral valve that's separating between the left atrium and the left ventricle. Now, number 22, this is the papillary muscle. Okay, so number 16 is a papillary muscle. All right, so it's this is just a little bit anterior, so sometimes we refer to it as the anterior papillary muscle. Now, if you look over here into the bulkiest portion right there, into this muscle, the myocytes, or the myocardium itself, actually, it's the myocardium. So the left ventricle has a wider and a thicker myocardium compared to the right ventricle. Why is that? Because this is pumping the blood into the systemic circulation through the left ventricular outflow tract. So this is part of the left ventricle. Okay, if you look over here into the valves itself, both valves would have kind of a finger-like projections, and those are referred to the chordae tendineae, or the chordae tendineae that's being attached to the papillary muscle. By doing so, they would keep the valves in place, and this is a unidirectional blood flow preventing reflux or regurgitation of the blood. Now, to the sides, right there, we have something called the right atrioventricular orifice, or the opening right there, and for the left we have the same thing as well. Okay, if I further look over here between both atrii, or between the atrium itself, we have something that's called the fossa ovalis. So this will close as soon as the infant is being born. And this is a hole right there, that's where it will be collecting venous drainage. So we will call the opening of the coronary sinus. So it will collect blood coming off from here, right there. And I'll talk about it in a few minutes. Okay, so this is just the inner portion right there. So let's go ahead and close this again. Let's bring everything back again to normal. Okay, so we have 2 more valves. So this is the pulmonic or the pulmonary valve, and this is the aortic valve. So the aortic valve would open up into the ascending aorta, into the aortic arch or the arch of the aorta, and eventually it will descend into the descending thoracic aorta, giving us different branches or arterial branches to the esophagus, bronchus, mediastinum along the flow. Okay, so let me back up a little bit. So we have the right. Now let's go ahead and do this. So if we have the blood flows moving along from the right atrium into the right ventricle, it will be pumped throughout the pulmonary or the pulmonic valve right there first. Then from the pulmonic valve, it will pass along the pulmonary trunk. And eventually this pulmonary trunk will subdivide into or bifurcate into a left pulmonary artery and a right pulmonary artery reaching out towards both lungs. So this is the right lung. Let's pretend that this is a lung and this is a second lung right there. So we have the right